Hello, everyone. Welcome to Lump Basics or Lump TCM and Acupuncture Basics. We are now on our 31st day. Welcome. We will continue where we left off last time for the first presentation. Energy flow between luo connecting and yuan source points 2. In the energy transference between yuan source and luo connecting points, it is not always necessary to use both points. It is sufficient to use only the luo connecting point. This has to be the luo point of what is deficient. For instance, if there is a yin deficiency and yang excess in the lung or in the large intestine, it is the luo of the lung, the yin organ, that should be used. Sedation of the yuan source point is used only when the excess proves to be the main problem. If a patient often gets paroxysmal tachycardia, only point heart 5 needs to be used in the intervals. But in the acute episodes, very young, you need to do SI for sedation and heart 5. Now let's have this example. Excessive spleen dampness, so very yin, and deficient functional qi. So as you can see that in the tower diagram, the yang is very deficient. Symptoms: because of the yin, increased yin, there is edema of the face, lower arms, and lower legs at the periphery, with stiffness and pain in the joints, mostly in the mornings. Peripheral edema is a weakness of spleen function of circulating fluid. According to their interior relationship, coupled organs have the same picture of imbalance. So, stomach would have the same imbalance. So, treatment. We sedate spleen 3 because if in this case, we have a very excess yin, and we tonify stomach 40, okay? So sedate spleen 3, yuan source point, to sedate spleen yin directly and sedate stomach yin indirectly. Tonify stomach 40, the luo connecting point, to tonify stomach yang directly and tonify spleen yang indirectly. Okay. The yuan source points are connected to the source of energy for the body. Mother Earth and all nutrients from her is the source of energy. It is therefore interesting to note that in the yin organs, the earth points of these meridians are also their yuan source points. So, using the yuan points will be similar to drawing energy from the organs associated with the earth element in the body. So here we have the yuan source points of yin organs and the luo connecting points of the yang organs. So if you sedate lung 9, that's the yuan source point, okay? This will impact now the Li6, which is the luo connecting point. So it's basically yuan source points and luo connecting points. Sedate pericardium 7, okay, then do something about the triple warmer 5, sedate heart 7, and the luo connecting point Si7. We sedate kidney 3, then we sedate bladder 58. Sedate spleen 3, then stomach 40, sedate liver 3, gallbladder 37. This imbalance may be in a yin organ or its coupled yang organ. The same points would be used to bring them to balance. Thank you very much for your attention. We now listen to Ma'am Needs You, certified acupuncturist from Silang, Cavite, for the second presentation. She will talk about the area distal points. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. So, topic for today, area distal points. Okay? Ayan po. Ayan. Nakita doon sa diagram o sa drawing kung ano yung mga distal points nasa kamay, nasa paa. Malalayo po doon sa actual na point. Okay po? Ano na lang po natin, intindihin. Okay. Meridian distal points sa organ systems. Okay? Ah, bawat organ meron kanya-kanyang distal point. Lungs, lung 7, large intestine, LI4. Take note po natin stomach 36, and stomach 44, spleen 6, heart 7, small intestine 5, urinary bladder, UB 37, 40, and 60, kidney 3, pericardium 6, triple warmer 5, gallbladder, GB 34 and GB 41, and liver 3. Okay po. Screenshot na lang po natin. Andiyan po yung drawing, pag-aralan natin kung nasaan ang mga locations po ng distal points. Okay? Yan po. So, the diagram above shows a man standing with two circles passing through him. One, the inner circle, covers the body, upper leg, and arm. Then there is an outer circle going through the head, hands, and the feet. This diagram will help you decide how to choose the meridian distal points on the three young meridians of the leg. These are long meridians that run, tumatakbo from the head sa to foot, and we need more than one distal point to treat symptoms on these meridians. Okay. When the symptoms are within the inner circle, the distal point should be at the knee or at the inner circle. If the problem was in the head or neck area, the distal point should be on the foot in the outer circle. Okay? Meridian distal points are used for any problem along a channel or problems related to that organ system. Okay? Pag-aralan po
Actually,
natin
Ma'am
yan.
Nitz, di ba ito yung una-una nating exposure sa Acute?
Oh, yes, Doc. Meron tayo pa nga mga ano yan.
Meridian distal points pala yon. Okay.
Oo, distal points. Para hindi masakit kasi pag ano. Okay. May example po dito. So sternuralgia on the side of the thorax can be treated as a problem of gallbladder channel with GB34. And as the lung is related to the skin, okay? Where there is more than distal point per meridian, mainly in the three young meridians of the leg, points at the knee are taken for problems of the torso, thigh, and internal organs, and the points on the feet are used for problems in the head and face. For example, point stomach 44 is used in treatment of the lips, mouth, and lower jaw because the face and feet are both in the outer circle. Whereas point stomach 36 is used for problems concerning the organ stomach, for diseases of the breast, abdomen, and along the front of the thigh, as problem along the stomach meridians in these areas. Take note po natin on the gallbladder meridians, point GB34 is used for temporal headache and pain on the side of the neck, and point GB34 for gallbladder pain and pain in the hips and sides of the thighs. Okay? The urinary bladder meridian naman is the longest meridian of the body. Therefore, it has three distal points. Point UB40 is used for problems of the organ. Okay? For pain along the meridian, use the point UB37. It is the closest distal point. It is used for lumbosacral pain. And point UB40 for thoracic backache, and point UB60 for cervical pain. Okay? Yun po. Remember po natin pag-aralan. Okay
So
po.
this is very important po sa beginners, di ba?
Yes.
Kahit ito lang, kunan mo ng snapshot. Tapos na yun.
Chat po natin.
Pwede ka na mag-treat.
Maganda yan. Oo. Hindi na pupunta dun sa ano.
Totoo.
Thank you po, Doc. Thank you, everyone.
Thank you very much, Ma'am Nitz. That was very helpful. Sana na-excite yung ating mga neophytes. Okay, as long as as long as ready kayo sa paglocate ng points, no problem, no? Okay. Okay, next we have needling techniques. Okay, for today, we shall discuss in detail yung tinatawag na spleen 6 descending technique. Okay, and this technique can change the entire energy situation in the triple warmer with one sweep. No, it has two indications. What are they? Kidney yin deficiency with ascending fire heat. Okay, so ibig sabihin medyo matagal na po yung kanyang kidney yin deficiency, nagkaroon na po ng heat, no? And another indication is when you have fullness in the middle, cold and weakness in the lower, ascending damp heat to the upper warmer. So let's start with the very common kidney yin deficiency with ascending fire heat. So this is very common sa mga perimenopausal women. So women out there who are not so young anymore, okay, please listen. Or in hyperactive children, or in anyone else na may dryness and heat in the kidneys. Heat will rise upwards, attacking the upper warmer, and this will create heat symptoms. Ano po itong mga heat symptoms? Hot flashes, sweating, mental restlessness, insomnia, tachycardia, and even high blood pressure. So the treatment is we try to descend the heat back to the lower warmer. Okay, and balance it by tonifying kidney yin and sedating yang. So parang, okay, since we want to balance things, we need to tonify kidney yin and sedate the yang. So spleen 6 descending technique is very, very needed here. Another situation when we have fullness in the middle, cold and weakness in the lower, ascending damp heat to the upper warmer. Okay, this is a common picture seen in Western men. Hindi lang yata Western, pati dito na, no? Okay, with beer belly, diba? Beer belly, where the dampness from fatty foods and heat from the alcohol stagnate. So this is something that everybody should remember, no? Especially those who can relate. Okay, beer can actually give you dampness, and the heat from the alcohol will stagnate. No, that will also be heat. The lower part of the body seems to be weak and cold, so with poor function of the reproductive and urinary systems. The full middle warmer, okay, malaki, does not flow downwards. Kasi dapat nagpo-flow siya downward as it normally should. Its flow seems blocked. Okay? The stagnant damp heat flows upwards to the upper warmer. And this causes symptoms of red face, hot head, high blood pressure, tachycardia, excessive speech, and mental restlessness. Okay, kaya pala, insomnia and respiratory tract infections. Treatment, unblock the energy flow between the middle and lower warmer so that the energy from the full middle flows downwards. Okay? And the pseudo heat symptoms in the upper warmer will disappear automatically. Ipapababa nyo. That's why we need to learn how to do the spleen 6 descending technique. Now, this is contraindicated in conditions where the blood pressure is low or the heart is weak. Bradycardia, arrhythmia, and angina pectoris, because it creates a depression in the upper warmer energy. So if there is already weakness in the heart, it could get worse. So please take note of this. No. So the spleen 6 descending technique is performed on spleen 6 point alone. Wow. Okay. It can bring down the heart rate within 1 minute and the blood pressure down within 10 minutes. So please take note. It can be usually used up to 3 times in the first week of treatment. So 3 times a week, no? And thereafter only once a week. Okay. So the needling technique is described. Okay, number 1, the patient should lie supine for this treatment. No other needles should be in the patient at this moment. Okay, if you plan to use other points, they can be needled later during the same session or should have already been so, and the needles. So kung meron na po, tanggalin na po yung needles. So needle spleen 6 bilaterally, just deep enough to stand. So not so deep, as long as nakakatayo yung needle. Okay. Stand at the foot of the patient and cross your hands. No, your right hand on the patient's right leg and the left hand on the left leg, and then twirl the needle. Okay. So with the thumb first upwards and then down pag babae. Okay, pag lalaki, with the thumb first downwards and then up. Do this 6 times. So take note, iba pala pag ano. Any comment here, Ma'am Neats? Okay, have you done this before? Okay, so pag women, you do, okay, upwards muna sa thumb and then down. So up then down, gagawin yang to yin. Tapos yung lalaki, thumb first downwards and then ano. So it's the thumb that will do the manipulating. Then tell the patient to inhale through the nose, swallow once, not to swallow air, and exhale through the nose. Okay, he or she should continue this breathing until you instruct them to stop. Okay, then insert the needle in at spleen 6 as deep as you can without twirling. If you encounter the tibia, no, ito po yung most likely na maninidle mo, matatamaan ng needle. Do not insert further. Repeat the twirling again at the deep level, and this time in both men and women, twirl needle with the thumb first downwards and then upwards na 6 times. Do 3 lifts and 1 thrust, repeating several times, with the needle becoming gradually more superficial. When the needle is just deep enough to stand without falling flat, leave the needle in place for 1 minute. The patient should still continue with the breathing, okay, as instructed. After 1 minute, prepare to remove the needle. Instruct the patient to change the breathing pattern, keeping his or her hands on their stomach. They should inhale through the nose and exhale heavily through the nose and mouth, and pull their stomach in while exhaling. Actually, this is an indication na lumalabas yung air when you're pag nag-exhale ka, no? Pag ililiit mo yung stomach in. The needle should be removed at the 6th inhalation. So I hope everybody will try to practice this because we can help a lot of people. Marami pong ganyang patient. Diba, Ma'am Needs?
Yes, Doc. Very inspiring.
Yeah, so we hope you can do a screenshot or probably download this part of the video because this is so important, no? Yung spleen 6 descending technique. Maraming salamat po. Next, we have Ma'am Needs, you once again for the earth element. Good afternoon po ulit, Ma'am Needs.
Good afternoon once again, Doc and everyone. So the topic for today is the earth element, the concept 6. Okay. Spleen secretes saliva. Kanina topic natin spleen, Doc. The spleen governs the salivary glands and saliva. Digestion of the food we consume begins in the mouth and saliva aids this. An imbalance of the spleen may result in excessive or deficient secretion of saliva. Lawa yan, no? When the yin is in excess, there will be excessive saliva, and when yin is deficient, the saliva could be thick or the mouth would be dry. Okay. Ito yung tower diagram. Parotitis is a damp heat state of the spleen. Okay, baka may mga parotitis. Ang treatment sa dry mouth or stomach deficiency, Pag local, use REN 24 and REN 23. Sa distal point, use LI4. Energy balancing, REN 12, the move front stomach, which tonifies the yin. Stomach 43 is the wood point of the stomach. It is the grandmother point, which tonifies the yin. Okay? Then po, make sure that the patient has no scar that blocks the REN and kidney meridians from flowing towards the face. This means the yin cannot come to the face. If there is such a scar yung ano yun eh, gawa ng mga wound, ganyan, scar, then it needs to be unblocked simultaneously. Also, it may be that the patient has a blocked nose and breathes through the mouth. If so, points LI20 and GB, gallbladder 20, should be given in order to open the nose. If there are nasal polyps causing the block, then surgery needs to be considered. So ito naman po sa excessive salivation, sobrang dami ng laway. Excessive dampness in the spleen. Sa local, use SI17 or stomach 6. Sa distal point, use LI4. Symptomatic, stomach 40, it is the circulating point against dampness. Use the energy balancing, spleen 5 sedation. Ito yung sedation point. It sedates the yin. Okay? Yan po yung gagamitin natin points. Problems with appetite and hunger naman. The sensitivity is the taste. Okay? The spleen and stomach sense taste, which makes eating pleasant. Usually, those with a young dominant state have a more refined sense of taste. They like taste in their food and a beautiful looking meal. They also like their food not to be masked by too much flavor and like to taste the original flavors of the food they are eating. Generally, it is the young dominant earth types who feel more hungry, madaling matakaw ba? And they cannot wait too long to eat when they are hungry. Gusto kumain agad. But they would still take their time to lay the table, decorate it with a flower, light a candle, and sit down to savor their small but beautiful meal. They would not settle for less. They like to eat in company and celebrate their food. So yung mga yin dominant people like to eat even if they are not hungry. When they want to eat, they don't want to wait for it for too long. They will put everything together and mix it up in one pot, which tastes all the same and looks all the same. Sama-sama, halo-halo. Or they will pull something out of a freezer and shove it in the microwave oven. Then they will pull it out and eat it earlier than the recommended time, as they are not willing to wait. Sitting with a book or on the TV, they will gobble the food, not enjoying the food but the eating. They also like to eat alone, mag-isa lang. Earth-type persons are best observed when they are eating alone. Gusto nila mag-isa lang. Okay? So, yun po. Thank you very much. I hope you learn.
Okay. Saan ka nakaka-relate?
Mag-isa lang. Hindi,
It's
masarap
okay.
kumain may mga
Spleen
kasama,
young
Dok.
dominant or spleen O. Kaya mag-isa yon kasi ayaw niya may kasamang
Ayaw may kaagaw, Dok.
ubusan, di ba ganun?
Oo.
Maraming salamat, Ma'am Nitz. Let's welcome Ma'am Teresita Sumile for the next topic. Good afternoon, Ma'am Teresita. Ma'am Teresita will now start discussing treatment and disease prevention principles. Good afternoon, Ma'am Teresita.
Yes,
Hello.
Doc. Good afternoon. Good afternoon, everyone. Treatment and disease prevention principles. Disease development from yin-yang perspective. So we have here pathogens or evils, factors disturbing the balance of the body. This an excess and then excessive yin evils, invasion of an external dampness or coldness. To Ulitin ko po. Pathogens, evils, factors disturbing the balance of the body will conflict the cause healthy energy, the body's resistant and self-healing abilities. And then,
Are you having trouble with your signal, Ma'am Teresita? Hello po.
yes po. Hello, Doc.
Oo, so maybe we
Sige,
can,
Doc.
sige, balik ka tayo mamaya, no? So let's,
Sige, Doc.
I'll probably, okay, let's talk about disease development from the yin-yang perspective. Okay, as you can see here, the reason why people come to us is nagme-manifest na po talaga yung disharmony or imbalance. So we have two ends of the spectrum, no? So we have the pathogens, which are called evils. Then we have the Zheng Qi, or the healthy energy, or what we also call the upright Qi, no? So they will be in conflict if there is a war, of course. So pathogens or evils are factors that disturb the balance of the body, while the Zheng Qi is the body's resistant and self-healing abilities. So every time there is yin and yang disharmony, there will be conflict. So when you have the predominant, like if you have the pathogen invading, okay, that's actually called excess. So when you have a very weak immune system or a very unhealthy Zheng Qi, then you will have deficiency. Okay, so let's talk about excess. You can have both excessive yin evils and excessive yang evils. Excessive yin evils, for example, we have invasion of external dampness or coldness. An example of excessive yang evil is invasion of external wind or heat. Now, on the other side of the spectrum, we have if you have yang qi deficiency, this is a physiological under-functioning. So that means if your yang is very deficient, then it cannot actually control the yin. So welcome niya po si external dampness or coldness. Yung isa naman, we have the deficient yin essence, no? That means you have insufficient nutrient materials. So you can definitely not protect yourself from excessive yang evils, no, external wind or heat. Okay, so you have yin excess on one side, yang deficiency on the other side, then yang excess or yin deficiency on the other side. So let's review the qi development here. Acquired qi can be stored and replenished and is composed of Ku qi or spleen qi derived from food and sustains the physical body. Then we have the lung qi or Kong qi, which is derived from oxygen or the air we breathe. Then we have the chest qi or the ancestral qi, the Zhong qi, derived from the gathering of, it's basically the combining of Ku qi and Kong qi in the chest. And this should be acted on by the Yuan qi or original qi to form the true qi or Zhen qi. Now, Zhen qi or true qi is composed of nutritive qi and wei qi. So this is just a review. So let's talk about the root and manifestation of disease. Okay, so the principle. So if the disorder is acute, you treat the manifestations first. However, if the disorder is chronic, so that means when the patient comes to you, wala masyado siyang problem, but it's a problem that has been bothering him for quite some time. So you treat the root. Another is simultaneous, or when do you do simultaneous treatment of root and manifestation? So you can have different treatments for the same disease or same treatment for different disease. And we treat disease according to the season, environment, and the individual. So let's compare acute with chronic conditions. Okay, so Acute conditions, a very common example is when you have a throat infection, strep throat, or a broken bone. You just met an accident, vehicular accident, no? So at the beginning is very rapid, okay? And the cause is usually only one. Duration is short. The diagnosis is commonly accurate, and the tests are often decisive. Treatment, the cure is common, and the role of professional is to select and conduct the therapy. And the role of the patient is, of course, to follow the orders and the advice of the therapist. Now, for chronic conditions, diabetes, heart disease, and arthritis. Okay, so the beginning is gradual, up and down, and there are many causes, and the duration is indefinite. Diagnosis is often uncertain, especially early on. No? Tests are often of limited value, kaya minsan gumastos na dami na wala pa rin. And treatment, the cure is rare. So you will be looking at a maintenance treatment. No? The role of professional is to teach and advise, and the role of the patient is should be the partner of the health provider. That is, if he wants to be responsible. And this is okay. And you know, it's like working together with your health professional, which is very, very advisable. Okay. So thank you very much for your attention. Let's now proceed to the next topic, Zangfu organs. Let's call on Ma'am Needs You, certified acupuncturist from Silang. Once again, good afternoon ulit, Ma'am Needs.
Good afternoon, Doc Hector, and everyone ulit. The topic for today is heart functions, okay? It governs the blood and controls the vessels. It houses the spirit or the shen. It opens up the tongue. It manifests in the facial complexion. Emotion of the heart is desire and joy, okay? It governs the blood and controls the vessels. Heart is responsible for circulating blood throughout the body. It depends on lung qi for this function. Okay? Kasama niya yung lungs. Okay? Lung qi. Lung qi needs heart blood to be nourished. Qi and blood must be in a harmonious balance to guarantee regular heartbeat. Okay? If heart is strong, if heart qi is strong, vessels are healthy. Pulse is regular and in harmony. Okay? It houses the spirit or the shen pa rin. Heart houses the spirit. This means the heart is the seat of consciousness and mental activity. Remember po. Heart depends on supply of sufficient yin and yang to give the spirit a surrounding in which it can flourish. Okay, kailangan niya yun. Heart possesses abundant yang but little yin. So that it is especially susceptible to yin deficiency. Yan yung karamihang nagiging sakit, yin deficiency. Okay? It houses the spirit or the shen pa rin. Yin deficiency causes the spirit to be deprived of its dwelling place. The spirit becomes restless. Okay, hindi nakakatulog. Okay? Blood is root of the spirit. It surrounds and anchors the spirit so that the spirit is at peace and can be happy. Okay? Heart blood deficiency causes the spirit to be restless. It leads to depression, fear, excessive dreaming, and insomnia. Yan yung cause. Okay? Unrest, depression, emotional problems affect the heart and lead to heart blood deficiency. Okay? Manifest in facial complexion. Health of the heart is reflected in the face. Facial complexion depends on the state of qi and blood. Okay? If there is enough blood and if the heart is strong, the face is rosy and shines. Ganda ng feature niya. Okay? Facial complexion is a sign of Qi deficiency or blood deficiency. Okay, remember. Blood stagnation manifests in bluish violet facial complexion. Okay, tandaan po nyo, blood stagnation. A red facial complexion is a sign of heat or heart fire. If the heart or other organs are the root cause, it has to be clarified by further examination. So, yan, kailangan. Okay. Health of the spirit is reflected in the eyes. Pale, dull eyes show a disturbance of the spirit. Okay. It opens at the tongue. Heart governs tongue, including the color, the form, and look of the tongue, particularly the tip. Remember. When the heart is healthy, the sense of taste is normal. The tongue can move normally and speech is clear. Okay? Disturbances of the heart can manifest as aphasia, tremor of the tongue, or impeded speech. Nabubulol-bulol. Continuous talking is a sign of disturbance in the heart. Yun pala yun. Emotion is desire and joy. Strong and excessive emotions, yung anger or jealousy, can lead to heat and damage the heart. Experience of emotions takes place in the thorax. Yun pala siya. Jealousy causes the pulse to increase and the blood pressure to rise. Nakapagkasakit pala yung jealousy. Emotion is desire and joy pa rin. The desire leads to heat and damages the heart. Desire is the absence of tranquility and peace. Okay. Being under time pressure can easily give rise to excessive emotion. Example, red traffic light can be a reason enough to cause an excessive emotion, which in turn raises the pulse rate and the blood pressure. High blood na kagad. Okay. I want is a root of desire. We all want to have certain desires satisfied. Example, buying a new car or to be successful in business. I want this, I want that. Okay. Goals are necessary in life, but it is important how we deal with our emotions and attachments, especially if we don't get what we want. Okay? Yan. We can only try our best and appreciate the driving force of desire to inspire us to work hard to achieve our goals. Okay? Thank you po. Thank you very much for your attention.
Thank you very much, Ma'am Neats. I hope everybody could relate to that, no? Ang dami po kasing may heart issues ngayon, 'di ba? In fact, number one killer disease is actually diseases involving the heart, 'di ba? Okay. Let's now go to the next topic. Let's check if the signal of Ma'am Teresita is already okay. Meridian theory. Kidney meridian of foot lesser yin. Hello, Madam Teresita.
Hello, Doc. Good afternoon. Good afternoon, everyone. The kidney meridian of foot lesser yin. The kidney meridian starts where the urinary bladder meridian ends at the little toe. Through point kidney 1 is at the foot sole. The meridian flows to the ankle, making a circle around the medial malleolus and flows up along the medial side of the leg. The three yin meridians flow very close to each other in this region, and it is easily possible to needle one meridian thinking it is another. One on the abdomen, the meridian flows close to the midline, moving further lateral at the thorax, finishing just below the clavicle at the thorax. The inner branches are the foot, meridian enters the heel, connects with the vertebral column, the kidney, and the urinary bladder, flows through the liver to the lungs, throat, and to the root of the tongue. Location of kidney 1 on the sole of the foot and the depression between the second and third metatarsal bones at the junction of the anterior third and the posterior 2/3 of the sole. Point explanation: as the meridian is the only one to flow from the foot sole, all problems of the sole and heel are treated as kidney problems. Point kidney 1 is the sedation point of the meridian, sedates more of the yin and some of the yang. As such, it is forbidden in growing children to sedate the kidney energy, which is needed in bone marrow and bone growth. Sometimes, even in adults, the sedation of kidney 1 would reduce kidney function. We do use kidney 1 as an emergency point in patients having an epileptic or fever fit, or when a patient faints. But when one needs to sedate the kidney in adults, point kidney 5, the Shecliffe point, is preferred and safe. In children, usually the kidney needs to be sedated in ear infections. In this case, an alternative way be to sedate the triple warmer meridian with triple warmer 7, which is the Shecliffe point, as the triple warmer meridian is the closest meridian to the ear. Sedation of the kidney or the urinary bladder meridian is contraindicated in growing children, as the kidney nourishes bone. Sedating this may cause problems. Okay? Now, kidney 1 moxa is a popular therapy in illness with cold feet. It is common for patients with backache and sciatica to suffer from cold feet. Warming the feet on kidney 1 with moxa will enhance the effect of the treatment. Okay? Kidney 2 location. At the medial border of the foot in the depression at the anterior border of the navicular bone, at the border of the red and white skin. Point explanation. The far point of the kidney can be used as a point to sedate yin when sedated normally, and to sedate kidney yang when used with the far dispersing technique. Next is kidney 3. Location on the depression between the highest prominence of the medial malleolus and the Achilles tendon. Point explanation. Easily the most important point on the meridian, the Unsource point, the earth point, and the meridian distal point. There are many arguments in the literature as to whether this point increases the yin or yang aspect of kidney, and the author don't wish to enter the debate. He feels that if the patient already has a kidney yang excess, this would worsen with point kidney 3. If the patient has a yang deficiency or deficiency of both yin and yang, this would help. Okay? Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now come to the last topic for the day, chest painful obstruction syndrome, or the chest P. We will continue discussing the patterns and treatment. Case history. We have a 74-year-old man who had been suffering from angina pectoris for 1 year. The attacks were elicited by exercise, by cold, and by eating. Pain in the chest was quite severe. He also complained of feeling of heaviness in the legs. He looked generally quite strong and had no other symptoms. His voice and his spirit were strong. His tongue was reddish purple with yellow coating. Pulse was wiry and full. Diagnosis. First of all, this is an excess condition because of the strong voice and spirit, strong body, full pulse, and tongue with coating. As for the chest pain, this is due to blood stasis in the chest. Blood stasis is evident from the character of the pain, purple color of the tongue body, and wiry pulse. Feeling of heaviness in the legs is due to dampness infusing downwards. Treatment principle used was to invigorate blood in the chest. Patient was treated with acupuncture only with good results. Main points were aimed at, of course, you have to invigorate blood and then eliminate stasis. We have pericardium 6, pericardium 4, stomach 40, REN 17, and bladder 14. Even method. Stomach 40 was used not for its capacity to resolve phlegm, but because when you combine stomach 40 with pericardium 6, it relaxes the chest, regulates the ascending and descending of qi in the chest. So take note of that combination, stomach 40 with PC6. We now discuss another pattern, excess pattern, turbid phlegm stagnating in the chest. There is pronounced feeling of oppression of the chest, pain in the chest extending to shoulder or upper back, breathlessness, feeling of heaviness, dizziness, expectoration of white sputum. Tongue, swollen body, sticky white tongue coating. Pulse is slippery. Phlegm obstructs circulation of qi in the chest, and this causes the typical feeling of oppression in the chest. So if your patient complains of feeling of oppression in the chest, that's caused by phlegm. Some describe it as heaviness or tightness. Phlegm causes some slight dizziness because it obstructs the rising of clear yang to the chest. The feeling of oppression in the chest predominates over any pain. This pattern very frequently occurs in combination with the pattern that we discussed last time, which is blood stasis in the chest. There is interaction between phlegm and stasis of blood. They aggravate each other. The relative predominance of phlegm or blood stasis can be evaluated according to symptoms, tongue, and pulse. So with phlegm, there is oppression on the chest. There is pain in the chest if it's blood stasis. When you look at the tongue, if the tongue is swollen with sticky coating, that's phlegm. Blood stasis, purple body. With regards to pulse, it's slippery if it's phlegm and choppy or wiry if blood stasis. Treatment principle: invigorate yang, resolve phlegm, open the orifices. Pericardium 6, bladder 14, bladder 15, REN 17, REN 14, stomach 40, REN 12, REN 9, spleen 6, bladder 13, lung 7, lung 9. Reducing or even method except for REN 12, which should be reinforced. Moxa can be used. Pericardium 6 opens the chest and moves yang in the chest. Bladder 14, bladder 15, REN 17, and REN 14 are respectively the back shoe points and front move points of the pericardium and the heart. Okay, they are the main points for CPO, chest painful obstruction, and in this case, moxa can be used to invigorate the yang. So you can moxa bladder 14, bladder 15, REN 17, and REN 14. Stomach 40, REN 12, REN 9, spleen 6, resolve phlegm. Stomach 40 also opens the chest and subdues rebellious qi in the chest. Bladder 13 and lung 7 open the lung passages to facilitate the elimination of phlegm. Lung 9 resolves phlegm from the lungs. Thank you everyone for joining. We hope to see you in our next presentation.